And his topic is about the challenges in organizing care for children with congenital heart defect.
Thank you for all. Professor Columbus, thank you for invitation, and thank everybody that stay and listen what I can say about the challenges in organization care for congenital heart defect patients in the Bosnia and Herzegovina. This is something about my city, the famous old bridge in Mostar, and this building is our new pediatric clinic in Mostar. When I drive before 2 days from Mostar to Sarajevo, I listen on the radio the famous Bosnian singer Dino Merlin that have sung "My Life is Switzerland, Almost Perfect." This is important for this. And the other thing, and I think about is that just his artistical freedom, or there is some connection between those two states. And when I start to think, both are in Europe, both are multicultural. In Bosnia, we have 3 official languages. In Switzerland, also 3, maybe 4. The Bosnia and Herzegovina have 10 cantons, and Switzerland have 26. But there is a huge difference between GDP, and in that moment I realized what Dino Merlin said about almost perfect. The Bosnia and Herzegovina is very beautiful, and we love her much, but it's so complicated. Divide into the 2 parts. The pink one is Republic of Srpska, and other part is Federation of Bosnia and Herzegovina. I will talk about the federation because all of children with congenital heart defect that born in Republic of Srpska goes immediately to Beograd, like a one-way street, which is very good for children. And on this green map, I put the city who have a pediatric cardiologist. So there is a big green hole between all of that city that is without pediatrician cardiologist. And we in the Federation have 3 clinical hospital center in Sarajevo, in Tuzla, and in Mostar, where every part in this federation, if they have the newborn with congenital heart disease, they must send in one of these 3 clinical centers. This slide name easy to understand, but I just joking. We have 1 country with 3 presidents, 2 parts. I mentioned the Federation and Republic of Srpska, and a lot of president of Federation, president of Republika Srpska, and prime ministers. And in all of that 10 cantons in Federation, we have president, prime minister, minister of health, and such a lot of administration. I hope that they made that administration for help people, but in practice is not so. Now something about past. After the war, 1997, in Sarajevo, start something that we call initial stage of pediatric cardiac surgery. And from Switzerland, USA, and Austria, couple of times per year came cardiac surgeon and with their team to operate our kids. This collaboration with Sweden, the Sweden team from 2009 to 2014 was really good. The new necessary equipment come from this international medical program. They came more frequent from Lund, from Sweden. All patients operate in Sarajevo. They also start to do procedure in neonatal, and more than 300 patients operated with more mortality rate. This part between 14 and 17 I call the golden time. In that time I started to be pediatric cardiologist, and for me that was a time where it's very easy was to be a cardiologist. In Mostar I checked the baby, diagnosed or just made the suspicion of a congenital heart defect, and I called my dear friend and colleague Mirza and said I have the baby with congenital heart defect. I sent in Sarajevo. They do everything that it needs to be done, and they done it very good, with very, very low mortality rate. Just these three diagnoses: hypoplastic left heart syndrome, transposition of great artery with VSD, and some malignant arrhythmia, we send aboard in other states. But in 2018, something was, I don't explain what, but all of this destroyed, and now we have this. I just put all the diagnoses because all of diagnoses, including the simple ASD, we now send out. Where we send in the city, in the hospital, which have contract with our health insurance. But how is that look? Maybe you don't see the Sansky most. This is real patients before a couple of months that born in Sansky most, and the neonatologist put some suspicion of the congenital heart defect and send that baby 95 kilometers in Bihać. They have pediatric cardiologists, and our doctor made the diagnosis of transposition of great artery, because that rule that she must send the baby in the biggest hospital. She sent in Sarajevo, 308 kilometers. They also check, and the diagnosis was right. And because we must send it out of the state, they send that baby to Istanbul, to Acıbadem, 1,115 kilometers. But for us who work with that children, it is a long trip. It must take a couple of days for that. I don't know in Greece and the other part of Europe, but in Bosnia and Herzegovina there is a rule that all patients with congenital heart disease born on Friday afternoon. How is that possible? I don't know. Yeah. And this is some patients that we send in the last 5 years. Number is around 18 to 19 per year, and this is a cost in our wallet. Divide with 2 and you will get euros. And something that I really cannot imagine, that one airplane transport cost 1,500 euro. I think that Professor Jovanovic said that in Belgrade one operation is 10 to 15 euros. And we pay just transport and then plus operation. There is a couple of us there that work and live and that cannot just stand and take it like a normal. So Mirza and his team tried to do something in Sarajevo Heart Center, and it worked for a couple of years, and it was very good, but it stopped with Corona crisis. Me and my team in Mostar start to operation first with a team from Germany, and then with a team from Croatia. We have our surgeon that have education in Germany. And after 1.5 years and 10 procedures, that was a moment that I think that it will be good. Now we have some experience. Probably we can start with some complicated things, and in that moment our surgeons moved to Germany and we stopped this program. But this program still works, and we started in 2022 with a team from Rijeka, from Croatia. They came to me a couple of times per year, and we have international clause of ASD, PDA, PFO, and until now we didn't have any complication. We have also a meeting in Bihać because of localization of Bihać is very near to clinical center in Zagreb, just 2 hours, and Mostar, Tuzla and Sarajevo is more than 4 hours. And we made such a deal that if they have a congenital heart disease, that they can transfer immediately in Zagreb, because in this case the baby came in Sarajevo and then in Zagreb, and that's a waste of time. And we made some deal, but after the couple of weeks the government of that canton fell down, and everything that we deal is don't function. This is one baby with Epstein anomaly, and probably one of the time when I was very, very sad and like a human and like doctors, because that baby died because nobody want to admit it to operation. And I start to think, is there any chance that I prevent that? And find the one doctor that learned me something about fetal echocardiography. And we started like 1 or 2 patients per month. Now we have more than 100 per year. I start with this machine. Now I have this one. You know that it can be better. And I often talk the joke when I first time tried to do fetal echocardiography. I asked the woman, "Are you sure that you are pregnant?" Because I cannot find the baby, then I cannot find the heart. But now I know. This is couple of fetal that we find, some rhabdomyoma, some pulmonary atresia without VSD, tricuspid atresia, transposition with VSD, pulmonary stenosis. And this came to me like dextrocardia, but if you see, it's intestine inside the thoracal cavity. We made a step forward and do the magnetic resonance, and that baby born and operate in Mostar, and it's now really good. We realized that fetal echocardiography is maybe for us in Bosnia and Herzegovina is something that is perfect, because when we catch the baby with a duct-dependent congenital heart defect, then we send in the Zagreb, Linz, Belgrade, Istanbul, that woman get delivery there, and the baby, how to say that, we don't have problem with that all of administration paper. And we have the first course of fetal echocardiography with 20 participants, with 45th pregnant woman, and we saw it that is good, and we make also the second one last year, and we plan this year third one. We have also the permission for the perinatology chief of our perinatologists that this course will be mandatory part of their education, and I think that it will be like that. What do we need? One center that I don't must to begging them to admit the baby, like Republika of Srpska have with Belgrade. Please, Vojo, I have a transposition, and he said, send me and the paper will come later. That it will be perfect. I hope that this is a light on the end of the tunnel, and maybe it's a train that go to us. we will see. That's everything for me. Thank you very much.
Thank you so much. It was very interesting, all the whole condition.
Yeah.
So, yes, please.
Population in Bosnia and Herzegovina all was 4 million. Now I think that the federation have all is 3, but the federation probably 0.5 million. Yeah. We have, in Mirza talk before a couple of minutes, probably 115 to 160 congenital heart defect. So it's okay, but this course is very nice. I start alone in Mostar. Now Mirza do it in Sarajevo. We have a doctor that do it in Bihać. One is in Zenica, one in Tuzla, so that net go wide, and it's very good for us.
Very interesting. Yes, please.
I would just want to comment that it's very hard to start a program where you don't have a cardiac pediatric ICU, where you don't have a surgical background, where you don't have enough knowledge. It's extremely hard. I know what we have gone, it was an average. So I think the Vlado is doing an amazing job there, and I hope and I'm looking forward to our cooperation in the future. We are helping as much as we can, and we are trying to help more. Sometimes we have organizational problems that we can't take kids from Bihać. There was a problem. I don't know why the kiddo didn't come to Prague. It's insane because the kid was traveling all around the country. And I understand this. This is very, very difficult. This relies only on people who actually devote their lives to those kids.
Yes, especially, what I wanted to tell, the initial step to set up a unit is built, on the human resources, qualified human resources. It means you have, to find that qualified people who are ready, to sacrifice a big part of their personal and professional life and be completely dedicated to this mission. This one is a mission. It depends on the fact that how, you conceive your job as a physician.
Yeah, I understand everything that.
For example, you mentioned the guy, went back to Germany.
Yeah, but I understand him.
Yeah.
Not completely,
understand.
because
we are not here, to criticize, but you have, to find out those dedicated people. I have a huge experience in humanitarian cardiac surgery. My foundation is in 25 countries. Since '98, we set up many programs in 25 developing countries. And I concluded that the most important step is this initial, to find that I start because the goal, the main target is to set up sustainable programs. And sustainable program means that you have to go and train people. And usually, we start with the humanitarian missions. We go, and then at the beginning we are, 10, 15 people. We cover, all the aspects of the pediatric cardiology, cardiac surgery, and anesthetist, nursing staff, and so on. And then gradually, we decrease, because during, these humanitarian missions, they are also very crucial, these humanitarian missions. We identify, these qualified people. There is qualified and ready, to sacrifice their lives in order to create a positive impact in their countries. And then, slowly, you build this unit. is like a baby who grows up. Yes, but you know, at the beginning, the baby should be healthy. And this baby, the baby has parents, and the parents, you know, in this project is the state and is the health authorities. For example, you know, I had in Mauritius a very good program because, you know, the state helped the program. For example, in India, we have sustainable programs because, you know, there is somebody, a spiritual leader who helps. He is, you know, completely involved in this program. The most important, again, you know, to have this political will to develop the program. Political will, you know, they have the easy way. There is, you know, some mechanism, you know, to send to refer, you know, these cases because sometimes, you know, sorry to tell that there is bribes. They prefer, you know, to continue with the solution, then, you know, to invest this money, this amounts, you know, to build, to set up the unit. Ready to help you, you know, if you need some help.
Thank you so much.
Yes.
Thank you.
Thank you, Prof. I think that the best example, in my opinion, as a country that Prof also started his career as a humanitarian aspect, and it's Georgia. I believe that the example of Georgia is unique in the world. Country of 3 million people, poor country, with many problems, political problems, war conditions from neighbor countries. What did they do? Okay, they took a funding from a humanitarian woman, American, okay, and they created one center for the country in the capital city of Tbilisi, and they offer until today operations of RACS 1 to RACS 5. They don't do RACS 6, they don't do transplants, okay, they don't do hypoplastic lefts, but they do everything else with a standard amount of money that is enough to support the center and also the local population. Why? Because if a child with congenital heart disease has one at least parent who is inhabitant in Georgia, they don't pay anything for the total amount of cost of taking care from neonatal life up to adult life. And they have put this plafond of money, that it's not too many, okay, it's about, with prices of 2020, it was $11,000. And it covered everything from an ASD or a PDA ligation up to a RACS 4 procedure like arterial switch operation. And I believe that the example of Georgia is unique. What do you think, Professor?
Yeah, Georgia was, you know, one of the first countries where I started. I started, you know, in Eritrea, but unfortunately they decided again, you know, to reactivate the war against Ethiopia, and then, you know, I stopped. And then, you know, the second country was Georgia, because I was very close to the son of, he was Minister of Foreign Affairs, Shwarnadze. And then, you know, he introduced to me. And then, you know, I found out two very rich men. I took the Department of Cardiovascular Surgery of Aristave Hospital, and then, you know, this American association, and then we built the center. Now, you know, they are able to do everything, you know, even switch operations. Then Mauritius, then Mozambique. Yeah, they cover, you know, the basic things. But, you know, in Europe, it's very sad, you know, to see, you know, this picture.
Yeah, I talk this story. When I talk with doctor, everything is simple. But when we came to talk with politician, is not so simple.
Vlado, thank you for your lecture, and I really admire your efforts. And I couldn't imagine your position when you detect some even VSD, and you cannot say anything to your parents of your patient. But I think of course, final solution for Bosnia will be the professor said, education of your staff. But meanwhile, I think that you have opportunities. Your country is not, Georgia is not in Africa. We have, I think your example, your lecture, is just what Professor Kalankos said today on assembly, that the goal of our society is not only these lectures and in 2 years congresses, but to help each other to find solutions. So our countries from former Yugoslavia are still connected in some ways because of nationalities, because of relatives, because of similar languages, because of similar problems. So I think that the best way for now is for you in Sarajevo, in center, to put a pressure on your politicians in Ministry of Health and other, just to make a state agreement. I didn't understand well you, nowadays, if you send a patient to Zagreb, do they need to pay or government will pay?
No, government will pay. Everything is normal when it's not urgent. But when
it's not
urgent,
why?
Urgent, because I have a lot of time to make the paper, everything that I need for VSD. But for that depend things, it's not so simple.
You know what is the connection with Montenegro and Republika Srpska? We have inter-state agreement. So if baby is born in Podgorica in Montenegro with TGA, for example, the same day they have papers, they have a flight, and they came to Belgrade, and nothing is need to be signed or paid. It is like our citizen from Serbia without any paper.
That is solution, and I asked that, but they don't give me permission for that.
Sorry. I don't know about price, but they have some agreement for that they covered, and we have no problem with the covering of costs. And when I just have a microphone, I just want to ask if for me, the main impression of this session is, if I understand well, is it true that in Greece you don't have any state hospital for congenital heart surgery? I mean,
just one.
Or no?
Yes. No, have.
You have. So
yes.
Misunderstand,
yeah. Two pediatric hospitals, Agea Sophia Children's Hospital and Aglaia Kyriakou Children's Hospital. It's Public hospitals, and yes, and we have and Vitera Children's Hospital and Euroclinici with Mr. Kalagos. We have, yes, and private and.
Okay, thank you all.
And the last but not least topic